Good day, everyone. Today we will be introducing the concept of community dentistry to you. We will be using this lecture today to generally introduce all of us to this module that is titled Public Health, Education and Community Dentistry. And we will have a conversation about how this module is going to run, and we shall be discussing some elements of the module that we'll be covering under this community dentistry course. And then we'll make a little bit of introduction into the terminologies that we should be expecting throughout this module. So the title for what we are doing today is Introduction to Community Dentistry, and my humble self, Promise Ucheka, I will be taking you on this module. So the aim of this lecture today proper is to introduce the students to the content of the community dentistry aspect of this module, and to introduce the public health approaches that could be taken to tackle important oral diseases and oral health conditions. Okay, so this is purely, like I've said, an introductory lesson to introduce us to the concept of to the content and the concept of community dentistry. So the objectives for today's teachings specifically will be to introduce the content of the module, especially the aspect of the module that concerns us in community dentistry. So to introduce community dentistry and dental public health, as we will be using interchangeably throughout this module, and then to introduce the public health approaches that we use in community dentistry, and also to introduce to make some definitions about the concepts that we normally use in community dentistry. So a little bit of a learning outcome for today, so that this is what will keep us focused. By the end of the teaching for today, I will be expecting that the students will be able to understand the implications of the definitions of dental public health and that of community dentistry. The students will be able to define a public health problem. So you should be able to tell us what is a public health problem. How do you know which problem is public health problem? Which dental problem is a public health problem? Which of them qualifies and which of them does not qualify as public health problems? And you should be able to consider dental diseases as public health problems, like I've said, and you should be able to formulate public health approaches that could be used to tackle dental problems. So the structure of this particular teaching for today is the teaching is divided into two parts. So the first part is where we will discuss this module. Generally, we'll look at the content of the module. We'll look at the structure. We'll decide on the structure that we are going to use to run this module for this semester, and then we will be just giving you heads up on the topics that we are expected to cover from this part of the module, because this is a shared module. We shall be looking at the two parts of the module today, and we will understand what we expected to do in the aspect of community dentistry. The second part of the teaching today will be to discuss what makes a public health problem, and consider approaches that we could take to tackle a public health problem, and consider some dental diseases as case studies. But like I said, this is a purely introductory. We shall be dealing with these things later on as we progress in this module. But today is just for us to get an overview of what we will be doing in this module. So the part one of this module of this teaching, sorry, the part one of this teaching today. So this is the module information, just to for for the purposes of reminding us again. So the course code will be RDTH 413, and the course title for this module. So this is the full course title. It's Public Health Education and Community Dentistry, and the course is divided into two parts. The part of public health education, which is being handled by the head of department, and while I will be handling the part of the module that says community dentistry. So that's what we've titled part 2 here. The part 2 here is the community dentistry, and I've put in parentheses dental public health, because by the time we finish the definition of community dentistry and that of dental public health, we will be subsequently using them interchangeably, and they won't differ. There is no great deal of difference in both terminologies. So the course content. So now this is the course content for the part 2 of the course, which is for the community dentistry aspect of this module. Okay, so the first thing we will be discussing under this community dentistry will be dental health education. And under dental health education, we shall be considering some important definitions of dental health education and some of the terminologies and keywords that we'll be using throughout this dental health education, both in the classroom and when we make the community, the practical side of dental health education. So it's important that we pay attention to this dental health education, because it will be forming the basics of what we will be talking about in the community dentistry in general. So the next thing we'll be doing under dental health education will be we'll be looking at the components of dental health education. We will be looking at education domains and the knowledge, attitude, behavior theories. We'll be looking at common oral diseases, under which we'll be looking at some definitions, some causes, and some preventative measures that we could take in community dentistry to tackle common oral diseases. And then we'll be looking at the principles that guide that underpin what we do in oral health promotion. So the next topic that we'll be discussing will be the planning, implementation, and evaluation of oral health programs. So under this topic, we will be looking at how to plan an oral health program. What do you need to do, both in theory and in practice? And then we will be looking at, after the planning, how do you implement what you have planned, and how do you evaluate what you have implemented? So the most important steps that needs to be taken in these oral health programs, we will be considering them under this topic. So we'll be doing both the theory, the classroom work, where we'll be looking at, we'll sit on the table and look at what we need to do, and we shall be practicalizing them as well. So the third topic that we will be discussing will be the dental indices used in oral health examination. The indices used in oral health examination. This is very important, because these indices is important you understand them. It's important you know the indices that we use in community dentistry, because they are very important when we are trying to make assessment. And under this, we'll be looking at some examples of the indices that we have in community dentistry. So things like dental caries index, we'll be looking at mobility index, we'll be looking at plaque index, periodontal disease index, we'll be looking at gingival bleeding, dental calculus, and even the dental anxiety index. However, this module, this topic rather, we will be dividing that into two. So the first part of the topic, we'll be looking at the principles surrounding the use of dental indices. So we'll be defining the indices. We'll be looking at different types of indices and different classifications of indices, and then we'll look at the principles that underpin the use of an ideal, that underpin the use of indices, and how do we know what is an ideal index. So we'll do that, and then we shall, in the second part, be considering these specific types of dental indices. So the fourth topic that we will be discussing will be school dental health. So we will be looking at the aims and the problems that are associated with school dental health. And I will be giving you some readings to do, some of the papers that I have authored and co-authored with some of my colleagues regarding school dental health. So it's important you read those papers in advance so that when we come to this topic, we shall be discussing it so that you can have a full knowledge of what we will be talking about. And then we shall talk about the primary oral health care. Okay, so under primary oral health care, we will be looking at the principles of primary oral health care, and we will be looking at oral health policies. Oral health policies, under oral health policies, we'll be looking at both local oral health policies, if we have any local oral health policies that concern us in our locality. We will look at that. We'll look at national oral health policies, and then we shall be looking at global oral health policies. So we'll be comparing oral health policies in different, as it is in different countries, and we will be looking at what we need to do to improve ours, and that will give us, that will prepare us for what is to come in the future when we are done, when we begin to function and practice as community dentists. So the part 2 of this teaching today will be just to introduce us to the concept of community dentistry. So we shall be considering some definitions today. So some important definitions that we need to know, or just we need to remind us about, that will help us through this module. Throughout this module will be definition of oral health, definition of community. We shall be looking at population. We shall then look at community dentistry and dental public health. So we'll look at the definitions and the implication of these definitions to community, to the practice of community dentistry. So this bit of this lesson, we've gotten this slide from the World Dental Federation. So they made this slide from the World Dental Federation, but it's important that I put this element of it here so that we will use it to refresh our minds when we talk about the most recent definition of oral health. We know that prior to this this definition that I term very inclusive definition of oral health, we've had oral health has been defined progressively from very long time ago. For so many decades, we've been in the business of defining oral health, looking at some elements or some emerging components and ideas that could make the definition better. But recently, I think about in 2016, if I'm not mistaken, the World Dental Federation proposed a new definition for oral health. And this definition, I believe, is very inclusive. It gives you a holistic approach to defining oral health. And it states that oral health is multifaceted and includes the ability to speak, the ability to smile, the ability to smell, taste, chew, touch, swallow, and convey a range of emotions through facial expressions with confidence and without pain, discomfort, and diseases of the craniofacial complex. So what this means is that looking at this definition of oral health, you now say that oral health goes beyond the teeth, it goes beyond the mouth. It's not looking at your emotions, your ability to express your emotions, how you feel. So there is beyond. So there is now the physiological aspect to oral health. We've not been able to accept that there is a physiological aspect to oral health, there is an emotional aspect to oral health, and there is, the functional aspect to oral health. So this is very inclusive definition of oral health, and these are some of the attributes of the oral health according to the World Dental Federation. So some of the important attributes to this definition include that oral health is a fundamental component of health and physical and mental well-being. So now you're talking about physical well-being, we're talking about mental well-being. So this goes beyond the teeth. So this is now taking into consideration how does oral health impact on someone's general well-being, physical well-being, mental well-being, and also how does someone's physical well-being, mental well-being impact on their oral health. So you look at it from a kind of a two-way direction, a bidirectional relationship between oral health and general health and well-being. Now, it exists along a continuum influenced by the values and attributes of individuals and communities. Now, it goes beyond an individual. We're not talking about community. This is why it's important for us to understand the implications of the definition of oral health to the practice of community dentistry. So the oral health it exists along a continuum and is influenced by the values and attitudes of individuals, and not only individuals. How does the values that is generally held in a community impact on their oral health? We shall be discussing these things down in this module. So by the time we go through this module, you will understand it, but it's important that you have this in mind. You always remember these attributes of oral health and as it relates to the new definition. So another attribute is that oral health reflects the physiological, social, and psychological attributes that are essential to the quality of life. Now we're talking about quality of life. Now you see, we're now beginning to talk about how oral health impacts on the general life that a person lives. So the life you lead, how is it impacting on your oral health, and how is your oral health impacting on your life? Before now, people did not take these things seriously. So that is why this new definition is very important to us, especially those of us in community dentistry, for us to understand and also for us to be able to communicate to people that their oral health, what they look at as just the health of their teeth, can actually go as far as impacting on their general quality of life. Okay, so another attribute is that oral health is influenced by the individual's changing experience, perceptions, expectations, and ability to adapt to circumstances. So you see, in the life course of a person, as the experiences of a person is changed or it progresses from birth to childhood to adolescence to adulthood, you see that their expectations, their perceptions towards their oral health will begin to change. So these things come together to influence how and the outcome of a person's oral health. So it's not just about how many times they brush their teeth, but also where they live, what the kind of environment they live, what kind of experiences that they have had in life, what kind of expectations they have in life, also the perceptions that they have in life generally have a way that it is either affected by their oral health or it affects their oral health. So this is a kind of framework for this definition of oral health. So if you look carefully at this framework that is proposed by the World Dental Federation, you will see that there are three major attributes to oral health. So we are looking at diseases and condition status of the mouth and the person. Now we're looking at the psychosocial function. How does oral health? So this is like a wheel. So you see how they wheel around each other. So how does the disease, oral disease status of a person impact their psychosocial functions and their physiological function. So these are this is a kind of a framework that you can use to understand the definition of oral health. Now, there are things that are acting on these elements. Okay, these core elements are being acted upon by what we call the driving determinants, and along the line in today and subsequently we shall be talking about determinants of health. So what are the determinants of health? What are the determinants of oral health? What are the causes of the things that we deal with in our oral health? Now, while these driving determinants are impacting and acting on these elements, they are being moderated by some moderating factors, and also that will everything will come together to give you overall health and well-being. So what will be the outcome of the individual's health? Overall health outcome of the individual will be determined by what is happening with these elements. We will be understanding these things a lot more as we progress in this module, because we're just making an introduction to the things we need to have in mind, and we will use that to progress in this module. So what is a community? So a community can be a group of people living in the same place, or a group of people having a particular characteristic in common. So a group of people, either geographical location. So you see, this is a group of people that are geographically located in the same place, around the same place, and they form a community. But also it goes beyond that. It can be a community of people who might not be living physically together, but having particular characteristics in common. We'll be looking at examples of community along the line. And then it can also be the condition of sharing or having certain attitudes and interests in common. So there are a lot of communities that exists beyond physical communities that we know. Like when we talk about communities, we always think about some locations. So we might be thinking about where we are from, what kind of community are we from, like locally, in terms of our area and ethnicity and race and all that. But it goes beyond that. So community is a lot more advanced today, but by the end of these teachings you will understand how to define community based on what you are looking at. So let's look at population. What is population? Here, population, all the inhabitants of a particular place. So this is the same, almost the same as the definition of a community. So if you want to look at the population of a place, you're putting into consideration every inhabitant of a particular place. So if you want to look at you can be looking at the population of a community. Okay, so the entire community can form a population, and it's important to understand this. A population can be a particular group or type of people living in a place, just as it is in the case of a community. So you need to understand the difference between a community and a population. So the population is the whole number of all the people that live in a community. So that makes a population. But also you can fragment the community in order to get to a particular population. So in community dentistry, when you're planning your programs, when you have interventions, or you're making assessments, or you want to carry out a survey, it's important for you to be able to define what is your community and what is the population of the people in the community. Biologically, a community of animals, plants, or humans among whom members interbreeding occurs. So they can also be a population. So when population goes beyond that of human beings, we can be looking at the population of birds, in the air or in a particular region. We can be looking about the population of fishes in a particular sea or pond. We can be looking at the population of anything. So when it comes to animals, the same kind of animal that live amongst themselves or plant even, and they interbreed among themselves. So you can use that biologically, you can define that as a population. Now, statistically, population can be finite or infinite. Okay, so we're looking at finite or infinite collection of items under consideration. So when you're looking at in statistics, when you want to look at a particular item, the item, it can be human beings, it can be animals, it can be non-living things, and then we're talking about the finite or infinite collection. So you're looking at the number of the things. So your population can be endless, it can be limited depending on how you define it in statistics. So having having in mind what we have defined community to be, is important we look at what community dentistry means. So now this is the branch of dentistry that is concerned with the diagnosis, prevention, and treatment of community level oral diseases. Okay, so we're now looking at oral diseases beyond the clinical setting. So this is no longer about chairside dentistry, where you have a patient that is sitting on your dental chair, you're sitting next to the patient, and then you're doing an assessment, you're doing an intervention, or you're doing you're recommending some preventative measures to be taken. Now it goes beyond that. It's not talking about a whole population. Okay, but in community dentistry, you need to define who your population is. Who is the community that you want to look at? Are you looking at a community of students in a school, in a university? The whole university can be your community. So the whole of the human beings in the university can be your community in community dentistry. Or you can take a fraction, you can take a level, you can take a course, the whole of the students that are studying a particular course, or you can narrow your community down to the teachers that are teaching a particular course. So you can define your community based on your interest and based on what you are trying to achieve. So by definition, community dentistry defined as the science and the art of preventing oral and dental diseases and promoting the oral and dental health as well as general health of people in the community. Okay, and it serves the community as a patient rather than an individual. So so this is like trying to show a little bit of difference between community dentistry and clinical dentistry. So in the clinical dentistry, when you're giving a patient, you have an individual. Okay, you have an individual that sits before you. You take the history of the patient or their complaint, and you do oral examination or physical or general examination, and you do a thorough assessment of what their case is. In community dentistry, your patient now is the community that you are looking at. So, and as we have said over time, over and over again, the community that you're looking at can now be a geographical location, it can be a country, it can be a region, it can be a state, it can be a local council, it can be a local community, it can be a church group, it can be a mosque group, it can be any people that you have defined to be the people of interest. So what does it mean when we say in community dentistry, we look at community as the patient that we are looking at? So at population level, so if the patient is standing before you now, which is your community, at population level, you can also do some of the things or use the same techniques that we do in clinical dentistry. So we're talking about diagnosis. What do we do in clinical dentistry when you have a patient? You do diagnosis, you can do prevention, you can do treatment of diseases. Now you can do the same thing with a community. So you can do diagnosis. How do you diagnose? What is the disease condition of the community. You can use surveys to do that. There is what we call community health need assessment. So you can do an assessment of their health need, and in this module we shall be looking at community oral health need assessment. How do you know what is the need of these people? Okay, it's important that before you plan any preventative program or what we could call treatment, I'm using the word treatment here, just trying to bring clinical dentistry into the community. So it's important that you carry out an oral health need assessment for the community so that you know exactly what their problem is, what is the problem of priority that they have, and then you know how to design a program to go about it. So dental public health, by definition, it is the science and art of preventing oral diseases, promoting oral health, and improving quality of life through the organized effort of the community or the society. So you see, the definition of dental public health is not really different from that of community dentistry. They are all about, preventing oral diseases. They are all about promoting oral health. They are all about improving quality of life with the effort of a community. So it calls, whether it's you call it community dentistry or you're looking at dental public health, they all go beyond the individual patient, but focusing on the population. So for me, I look at dental public health as the branch of dentistry that deals with public health issues, and also as the branch of public health that deals with dental issues. That is how the simplest way that I can explain what dental public health is to anyone. So community dentistry or dental public health, whichever one you choose to call it now, they are both concerned with understanding a population's health problem. So remember, we talked about health need assessment. So when you carry out a health need assessment, you need to understand the health problems of the population. Failure to understand the health problem of the population, you might be designing an intervention for the wrong problem. Okay, so if the problem that is prevalent in this population is dental caries, and then you are talking about fluoride. Okay, so these are ways you can use to help the community to prevent dental caries. So you need to now do an assessment to know what is the reason, why do they have so much dental caries, what is their fluoride intake, do they have water fluoridation, are they using fluoridated toothpaste, and how else can we augment what they have. So then you begin to now plan your programs, preventative programs to help them curb the spread and the spread of dental caries amongst the population. Then you try to establish the causes and the effect of those problems, and then you plan an effective intervention. We shall be looking at what makes an effective public health intervention. So dental public health practice or community dentistry practice is concerned with promoting the health of the population, and therefore focuses action at the community level. Okay, so the action is focused at the community level. It goes beyond action on individuals. So implications of definitions of dental public health and that of community dentistry. So looking at it, some of the implications is that it is more about the community than it is about an individual patient. Okay, it serves the community as a patient rather than looking at the individual as a patient. Okay, it applies dental research to community settings rather than in a clinical settings. And then it focuses on the causes of the diseases. So there we're talking about the determinants of oral health. So when you're talking about the determinants of health or the causes of oral health, we are now looking beyond the clinical causes of oral health problems. So we're looking at, say, we're talking about periodontal diseases. We're not looking beyond what is causing that periodontal disease. We're looking beyond dental plaque. Then we begin to look at what kind of jobs do people do? What kind of income do they have? What kind of life have they lived? What kind of society do they live? What kind of amenities do they have access to? And we look at how these things play parts in their inability to, adopt plaque control that is leading to the development and progression of periodontal diseases. Okay, the administration of group dental care programs is what you use in community dentistry, other than looking at single patient preventative programs or intervention. And then we also look at how dental services are organized and supervised in community dentistry. So you look at the organization, what are the things doing, what are the services that people in your community have access to. Okay, so you look at the distribution of the services beyond what a regular dentist will be doing in the clinic. So what are the things that constitute a public health problem? Okay, remember that we have said that community dentistry or dental public health is the dental aspect of public health or the public health aspect of dentistry. Now, how do we know what is a public health problem? So for any dental disease to qualify as a public health problem, it needs to meet certain criteria. For a disease or condition to be classified as a public health problem, it must meet one or more of the following criteria. One, it must be common, widespread, or a serious condition. Okay, so we are considering the epidemiology of the disease in terms of the incidence and the prevalence. Now, for you to say that a particular dental disease is a public health problem, you need to be looking at how common that disease is, how widespread, how many people are affected, how many people can we reach in this program, how many complaints do we have, how widespread, what is the distribution of this problem among a particular community of interest, and also how serious is it. Okay, these are factors that you need to consider for you to be able to define a particular dental disease as a public health problem. So any dental disease of interest that you're looking at must also have some severe consequences to either the individual who is suffering it or the community as a whole. Okay, the impact. So here we are looking at what is the impact of having this problem on a person's daily life. So the people who have it in the community, how does it affect them and how does it affect the functioning of the community as a whole? So you're looking at the consequences. So at first you're looking at the commonality, how widespread it is, how serious it is. And now, if we establish that it is widespread, it is common, there is more people, so many people, there will have records of people coming to complain about having this disease, or you've done a community-based oral health need assessment, and you have, found that this particular problem is widespread among this community, and it is common among them, and it is a bit serious. Then you'll be looking at the consequences. If we don't treat this problem, if we don't stop this problem, if we don't control it, what are the consequences? Does it affect their daily life, or is it something that, we know is there, but can go about their daily life forever and it won't have any impact? So you need to put that into consideration. What also is the level of cost that it poses on the people? So does it pose a great cost to either the individual that is having this problem or the community as a whole? So when we're talking about the cost of that problem, the cost of having this problem as a person, or the cost of having this problem as a community, we are looking at, excuse me, we are looking at the financial cost, not only the financial cost as well, we're looking at the cost to the individuals and the cost to the community as a whole. So for example, we are looking at how much will it cost for an individual to manage this problem or to have this problem treated. So if you multiply that by the number of people that have this problem in a community, then you can be able to make an estimate of what this community could be spending financially on this kind of a problem. Okay, now what about the other causes? Does it make people to lose hours from their work? So people are calling in sick, saying they can't come to work today because they have a certain dental problem. So that also creates its own cost. So time lost from work is also a kind of cost. And then what is the cost of treatment? Does it cause pain? Does it cause injury? Does it cause deformity in a person? So these are costs. So when we say cost, what is the cost? Does it pose a great cost to the individual or the communities? We are talking beyond financial cost. And now, for it to actually qualify again as a public health problem, you need to consider if it has any effective method of prevention or alleviating the pain. Now, this is very particularly important because if you know that there is a problem, you know there's a problem in a community, and then you know that it's widespread, you know it's got big consequences, both for the individuals that is suffering it or for the community as a whole, and you know it's going to cost them a lot, you know, to manage or to live with this problem. You know all these things, you've been able to, you know, establish all these facts, but there is no effective method of prevention and there is no effective method of alleviating it or curing the disease or solving that problem, then it still does not qualify as a public health problem. Because what is the point of worrying about a problem you can do nothing about? So it's not, it's there, you know it's there, but it's not a great deal because there is not a great deal of help that you can give to the people that have the problem. So what are some of the principles that underpin the public health actions and interventions that we employ in community dentistry? Okay, so for you to take an action of, propose an intervention for a particular, program you want to do, either for a particular disease or for a particular community, you need a strong evidence supporting the need for the intervention. Now, along the line in this model, we shall be looking at evidence-based dentistry. Under evidence-based dentistry, we'll be looking at how to find evidence in dentistry. So the programs, the measures, the preventative measures, the treatment that you recommend, what is the evidence behind it? So we'll be looking at the evidence behind the intervention or the program that you want to take, for a particular disease, a particular problem, or for a particular community. So there must be a strong scientific evidence to support that there is need for the intervention. So there must also be evidence for the feasibility and effectiveness of the intervention. For example, if you design a wonderful intervention that is not possible, it's not feasible, there is no way this can work in any setting, in the particular setting of interest. So you can have the right problem, but you have designed a program for an intervention or an action that is not feasible. Okay, there is no evidence to support that this is feasible, this is workable, and there is also no evidence to support that it is effective. There is no evidence to support the effectiveness of that particular action you want to take. So then you have a problem. So remember, we're looking at some of the principles that underpin the actions that we take, the public health actions we take in community dentistry. So we've said there must be evidence to support the need for it. There must be evidence to support that it is feasible, and there must be evidence to support the effectiveness. Now, there must be good public support and acceptability for the intervention. Now, this is to say that there could be evidence for the need, there could be evidence for the effectiveness, but you introduce a program in a community where, let's say, for instance, for some religious reason, you are bringing in an intervention that goes against the predominant or the prominent religious belief of the community that you are trying to bring this action or intervention to, then there will be no public support for it. They will kick against it. And if it is kicked against, if you don't get enough sufficient public support for it and it is not accepted, then the action will not work. Okay, the action will not work because it has not been accepted, by the community. You also need good professional support. Good professional support here. So you're looking at, so you have designed, you've crossed this number one, you've established that there is evidence to support the need. You've established there is evidence for the feasibility, the effectiveness of this intervention. You have gotten a good public support for the community that you are planning this program or this action for, and they have accepted it, but you don't have the professionals to put that into reality, then you have a problem with your intervention. But if you have all these things in place, but then there is no economic benefit for, there is no economy, you cannot justify what is the value for money, what are you trying to achieve? Okay, if you spend, if for instance you are planning, if you are planning, let's say screening program, for instance, say you are planning a screening for oral cancer or any other form of cancer, and we know that there is consequences. So if people want to treat cancer, whichever kind of cancer, is going to cost them money, it's going to cost them time, sometimes in worst case scenarios, it costs them their life. So if you spend plenty of money to, help to screen for cancer, early detection, early treatment, and then you might have economic benefits because you save people. The earlier it is detected, you'll be able to save people the stress and the money that they would have spent or the risk of losing their lives. So you say there is economic benefit, but in a situation where it just doesn't make any difference whether you do the program or not, it doesn't make any financial or economic difference, then there will be no need for taking such an action. So what are some of the common oral diseases or dental diseases that we will be considering in this module? So we'll be looking at dental caries and periodontal diseases, which are some of the most popular diseases in the world. We'll be looking at oral cancers and other oral diseases that will crop up as we progress in this module. So we'll be talking about prevention. It's important for me to mention here that there are two types of prevention that have predominantly, that have dominated our space, clinical space, and even in the community settings as well for the past few decades or for some time. We're talking about clinical prevention and lifestyle prevention. So in the clinical space, any preventive measures that is taken in the clinic for a particular individual in order to help to prevent the progression, the onset or the progression of any clinical disease, we can call that clinical prevention. What about lifestyle approach to prevention? So in lifestyle approach to prevention, we're talking about mainly health education that we have been doing. So in clinical dentistry, every time that you see a patient, we give what we call oral health instructions. Okay, we give a set of information to this patient, and then we teach them, we educate them. Everything is about the patient, the clinician now taking the position as God and loading the head of the patient with as many information as the clinician can lay hands on. You educate, and then you talk about their lifestyle and all that. So that is a lifestyle approach to prevention. So a bit of a clinical prevention here, a reminder, you have dental visits is the first most important clinical prevention, to be honest. I believe because if a patient does not come to the clinic or they don't come for checkups after they've come the first time, and then you won't be able to help them. So I believe that the first step in clinical prevention will be effective dental visits. Okay, because it is when you visit the dentist, then they will be able to do regular oral examination and be able to find out whether you have developing diseases and also monitor your condition. But then there are other things that we could do in the clinic to help prevent diseases or to at least curb the progression of some diseases, which include scaling and polishing, dental flossing, oral irrigation, oral cancer screening. I've mentioned that before, and in most cases, smoking cessation. Then examples of the things that we do as lifestyle approach to prevention. Then we're talking about education. Now, these days we now have things like motivational interviewing, things like health coaching that is gaining so much popularity now in as a better approach actually against health education. So, but what are a few facts about health education? So health education, oral health education, if you want to bring it directly into community dentistry, it's a kind of something that's been very popular, amongst clinicians in the past few decades. So, like I said, if you've been through dental school, the most important, one of the things that they will keep emphasizing to you is, teach, educate. You need to, give as much information to the patient as possible. But the question is, to what extent does health education work? Do we really think about how much of what we teach our patients do they do at home? So, of what importance, of what use is health education? Have we done a bit of evaluation on our own patients to know how much of the information we give to them is of use to them? So, one thing about health education is that it's known to, the educational approach, to health somehow increases inequality amongst individuals or communities. So this is because, when you look at two people that have a particular disease and then they come to you, you look at their history, you find that they are from different backgrounds. So one person might be more educated than the other person. So if you give health education, one person it might be more likely to adopt some of the things that you have said and implement that and get benefits. So if there is any benefits that will be gotten from the message you've given, it might end up being the person that is already well off. So the person that has more education already, the person that has a better job, the person that have, whose perception to life, whose expectations are a lot higher. So the one that are of a lower class or a lower grade of a person, so who doesn't have so much education, who doesn't have good, a great deal of expectations in life and all that, they might be less likely to adopt the education. Okay, so people who are more educated and more healthy, more wealthy, are still those who are more likely to adopt the educational measures that you give to them. So what this does is that you have two people in your clinic. One is a poor person, the other one is a wealthy person. The wealthy person also might be the one who is educated. He might be the one who is in a good job. He might be the one who sees himself in a better place in the next 5 years. So when you give education on, say, oral health improvement, or how they could improve their oral health and how they could stay off diseases, the one that has, whose life is better now, so to say, is more likely to be the one who will adopt the education. So as that person's oral health is getting better and better, the other person's oral health is becoming worse and worse. So you see that education in most cases creates this problem of inequality. Other problems with education, especially the way it is practiced amongst dental practitioners, is that sometimes it adopts a victim blaming kind of approach. So we always talk about, it's the patient's fault. If it's the patient's fault that they did not do what you told them to do, it is their fault they did not listen. It's their fault they did not brush 2 times a day. It's their fault that they have not been coming for dental visits. So we tend to do more of victim blaming. But when you look at the causes of diseases, like as we're talking about the determinants of health, so if you look at the social determinants of health, you'll be looking beyond the immediate cause of what is happening, and you then go beyond that to find out what is happening in the life of the person. So it's important, or it's possible, that by the time you dig deep into the life of this person that you are blaming through the education, through the design of the education, if you can use a different approach and go use it's a kind of social determinant approach, I don't know if I should say that, but you're looking beyond the immediate cause of the problem. So you're going far behind to look at what is happening in their lives. You might be able to see the need for a different approach. Okay, so victim blaming, accusations, and you make people feel like victims. Okay, and when people feel like victims, they are less likely to change their behavior. So accusation, you accuse them of not doing the right thing. You accuse people of not doing the right thing. You should smoke, you shouldn't smoke. Why do you smoke? You should do more exercise. You should eat more healthy. You don't know whether the person you're asking to eat more healthy, you have not considered what are the food choices and options available to the person. So education, even though it's good, but it might not be the best approach to adopt in community dentistry. So now we're looking at causes of oral diseases or oral ill health. So we're looking at diet, so poor diet or dietary choices, oral hygiene, poor oral hygiene. You have some genetic factors. You have exposure to fluoride. Some people get fluoride through using the use of fluoridated toothpaste or fluoridated water fluoridation, and other sources of fluoride like the fluoride varnishes or pits and fissure sealants and all those things that could give you fluoride. So then other causes will be tobacco use, trauma, accident, injuries can also cause dental problems. And then I talked about dental attendance. Remember I said that dental visit is the first step in prevention. So now, what are the better public health approach to prevention. So if you're looking at the determinants of health, it's a better approach to prevention than the education approach. Okay, so in the determinants of health, you're looking at the causes of the causes. So you're going beyond the direct causes of the problem, of the immediate problem. You're looking at what are the things that cause those things. So if a patient is supposed to brush 2 times a day, do proper plaque control, why are they not doing it? Why are they unable to come for dental visits? So there are reasons behind everything. So you consider the causes of the causes of what you're seeing, and that is what we do in public health, and that is what we do in community dentistry. So as we progress in this module, we shall be talking a lot about determinants of health, social determinants of health, and determinants of oral health. We shall also be talking about the causes of dental diseases. So you have that in mind. So some important causes of diseases will include things like education, things like income, things like age play a factor, things like ethnicity, things like social and physical environment where the person lives, and things like gender. So let's take, for instance, age and gender. How does age and gender play a role in the health outcome of a person? So let's take periodontal disease, for instance. Age play a role. Say age and gender could go together to play a role. So which gender will be the people that will be more prone to periodontal diseases? So looking at women, what group of women? So you might be looking at women of childbearing age. That's what we call pregnancy-induced periodontal disease. So men do not carry pregnancy. So the fact that a person is a woman and the person is going to go through pregnancy at one point in their life makes the person be more predisposed to having periodontal diseases. Okay, there are also other hormonal changes that happen in women during menopause as well. So at that time, some women also have experience of periodontal diseases and other general issues as well. So you see how age, so because when talking about pregnancy, you need to get to a certain age to be able to hold a baby, to be old enough to carry pregnancy. To see how age plays a part there, and for you to hit menopause as a woman, you need to get to a certain age. So age is a factor, gender is a factor. So some common risk factor approach. So we're not talking about the factors that can cause diseases or oral diseases. Then what are the common risk factor approaches? So in this module, we shall be talking so much about common risk factor approach. How do you use one intervention to tackle multiple diseases? Say smoking, for instance. Smoking has been implicated in cancers. Smoking have direct impact in heart disease. Smoking have direct impact in respiratory disease and also to periodontal disease. So if you have a patient in your clinic and you're talking to this patient about smoking, you might be talking to the patient about smoking having periodontal disease in mind, but if you're able to get them off their cigarettes or any kind of tobacco, you will be saving them a couple of cancers, you'll be helping them to save themselves of the trouble of heart disease and that of respiratory disease. So you're targeting a common risk factor to all of these diseases, which is smoking now is the common risk factor there. So as you help them to, minimize or get off smoking, then that intervention will be cutting across other diseases beyond periodontal diseases. So at this point, we will say thank you for being part of this class, and we will be discussing further using this concept that we've been able to define today to look at what we'll be doing further down in this module, community dentistry. Thank you and see you next time.